Hey, it's Dr. McNabb. So I wanted to share some really awesome stuff with you guys. PRP, or otherwise known as platelet rich plasma, it is a form of regenerative medicine that has been used for a long time with athletes around the world. And more commonly in America for the general population for about the last 10, 15 years. And platelet rich plasma, the whole idea behind it is to heal the damaged tissue. So, if you're having things like tennis elbow or golfer's elbow, or even like meniscus tears, rotator cuff problems, shoulder issues, even things like plantar fasciitis, the idea should be not just to treat the symptoms of those things, but to more so to actually fix the root cause of the problem. And so I was reading over some research and some articles, and there's been a lot of it published. Clinically, we've seen a lot of really good success. And one of the articles published in the Physical Medicine and Rehabilitation Clinics of North America Journal, and this was way back in 2016, it just shows the amazing effects and basically how it works. And so let me kind of break it down a little bit for you. So basically how PRP works is we do a blood draw. Just take out some blood, right from your forearm, just like you do when you're giving blood or having, some blood test, some blood work done. And then we put it in a tube and we spin it in a centrifuge. And when you spin it in a centrifuge, it separates the red blood cells from the platelet-rich plasma. And that plasma portion up there, that is where all of the white blood cells, that's where all the healing and the growth factors live. In your blood. And so when you do that, and when you take that and do a direct injection of that into the elbow or shoulder or knee, what you're doing is you're flooding the area with those healing and those growth factors. And a lot of those areas, they have a hard time healing by themselves. And although that's the ultimate goal, if you're still using that joint, if you're still using your shoulder, your elbow, or, certainly your knee or your foot, if you're walking on it, and obviously those joints are very difficult to avoid, any kind of further damage. If you're still using those joints, then they're having a hard time healing. And a lot of them are just repetitive type stuff like golfer's elbow, tennis elbow, or, the shoulder and the knee issues. And so instead of treating the symptoms with things like cortisone shots or painkillers or oral corticosteroids or even the gel shots, a lot of people are doing that now in the knees, which is just a synthetic lubricant. It's like putting WD-40 in your knee. That's not going to fix the damaged tissue. That's not going to repair the meniscus. And the painkillers and the cortisone shots, while it'll help you temporarily reduce the inflammation, and yes, that's one of the problems, that's not the only problem, that the tissue is damaged. And so PRP, it's been around for so long, and you've seen these athletes, even way back in the 90s using it, like Kobe and Jordan, and I think they kind of made it famous way back in the 90s. But, as I said, again, for the last 10, 15 years, it's been more common in the regular kind of sports medicine, kind of orthopedic world. And, so we've been doing it, again, here in our office because it's more helping people fix the root cause of the problem instead of just masking the pain and the symptoms. And as if you're a chiropractic patient, that's what we do. It's not just about treating the pain and the symptoms. It's about actually fixing the true root cause of the problem. And so I'm loving it. We are seeing amazing results. And the research it's there. It's been there for a long time. So I just wanted to kind of share this information with you. I was kind of geeking out and doing some research, and I'm reading it here on my computer screen. And so I wanted to share that with you. If you're having, issues with joints, even small things like elbows or carpal tunnel in the wrist or shoulder or knees, let us know. There may be a very, very quick, easy, affordable option in doing some PRP. So I'll send you a video, maybe along with this link. If you have any questions, please let me know. Love sharing this stuff, and this is kind of my health tip for the week. I'll see you guys later.